This is a press call from the National Council for Occupational Safety and Health. We are releasing today Preventable Deaths 2016, which is an annual report that we do on occupational fatalities in the workplace. It's in observance of Workers' Memorial Week. Tomorrow is Workers' Memorial Day, April 28th, and Workers' Memorial Week is being observed all across the country. We have sent a copy of the report to all the journalists on the call. If you don't have it for any reason, please email David or I, and we'll get it to you. It'll also be available on our website. And the infographics that are in the report are available from the report itself, and there's also a separate gallery. We'll share that with you, and if any of you want to reuse those in your publications or websites, you are free to do so. Please credit National COSH. Presenting today will be Jessica Martinez, our Acting Executive Director. I will present as well on our outstanding health and safety stories. We'll hear from Mary Jo Hoyt, whose brother was a temp worker who was killed on the job in New Jersey, and we'll hear from Scott Hall, who is a senior counsel for occupational disease and toxic exposure at Motley Wright. The order is a little different than what we have up here, but those are the names and identifications. If you need any of that after the call is over, let us know. We'll make sure you get it. And with that, I'll introduce Jessica Martinez, the Acting Executive Director of the National Council for Occupational Safety and Health.
Thanks for the introduction, Roger, and I also would like to extend my appreciation to my fellow speakers and colleagues. As Roger mentioned, I am with the National Council for Occupational Safety and Health. We're a network of over 20 COSH groups across the country. Our COSH groups are committed to education, training, community outreach, and advocacy around workplace health and safety. For those who are not familiar with our network, I invite you to visit our website, nationalcosh.org. And as Roger also mentioned, there's a series of information, including our reports and a link to Workers' Memorial Week events. Today we're here to release Preventable Deaths 2016, which is National COSH annual report and marks Workers' Memorial Week. This year it's April 23rd to the 30th. We have an extensive network of COSH groups and allies organizing over 90 events across the country, commemorating the lives of workers, but most importantly, a call to action. David, if you could switch to the next slide. As our slide shows here, we have several of our fellow advocates are part of our network organizing events across the country. This is just some images here is just a reflection of the couple of images of events that we have happening in some of our big cities, Los Angeles, New Jersey, New York, and other small and large cities. Every year we honor workers who were killed on the job and renew the fight for better safety conditions. We have some significant information to share that concerns us all. Also, for the first time, we are recognizing outstanding health and safety stories for 2016. We'll get to that a little later on today. But for now, I wanted to reference and outline some of the major highlights from our reports. I have a bit of sad news to share. One of that is that more workers are dying. This is something we wish we did not have to report, but workplace deaths due to traumatic events are up this year. 4,821 deaths in 2014. This is up 5% by deaths in 2013. The latest data from the U.S. Bureau of Labor Statistics, which every year compiles a census of fatal occupational injuries, says that these are sudden traumatic events in which a worker lost her life or his life in a U.S. workplace. Our report is the first analysis since those numbers were released on April 21st. So who's at risk? What do the numbers tell us about who is at risk? The number of deaths increased in agriculture, construction, mining, and manufacturing. More than 1/3 of all workers who died on the job due to traumatic incidents in 2014 were 55 years of age or older. The preliminary death toll of 1,691 for this age group is the highest ever recorded. Another important at-risk group to note is that 802 contracted workers or temp workers died on the job in 2014, representing 16.7% of all fatalities. This is 7% higher than the 749 contracted workers who were killed at work in 2013. Based on reports from workers and safety experts, as well as the results of accident and fatality investigations, we know that contract and temp workers are frequently assigned to the most hazardous jobs on many work sites. So why this sudden increase in deaths? We really need more studies. Revised numbers just came out, and this is our first look at them. However, we do know some of the things that lead to hazards in the workplace and potential fatalities. In too many cases, employers are not meeting their legal obligation to provide safe working conditions. We also know that there are not enough inspectors, OSHA inspectors. There's less than 2,000 occupational safety inspectors for the whole country, both state and federal, and there are more than 8 million workplaces in the U.S. Hazards in every one of these workplaces, not enough inspectors to look at them. It would take more than 100 years to get to every single workplace, so many never get inspected. We also know that there's not proper training always available. Workers are not always receiving training as required by law, and materials, information not routinely available in a language workers can understand. We also know that many times employers push productivity over safety. One example is when Don Blackmanship was sentenced to 1 year in prison after the deaths of 29 miners at Upper Big Branch. Acting U.S. Attorney Carol Costco said, putting profits over the safety of workers is reprehensible. What Blankenship did was absolutely reprehensible, ignoring common safety practices to vent dangerous gases underground. He should be in prison for more than a year, but the fact is he is the only executive to put profits, production above safety. He is not the only executive. It happens every day in executive offices, and that's one of the reasons thousands die every year. I also like to highlight that our report outlines new estimates on deaths from occupational illness due to long-term illnesses. Cancers, lung, kidney, heart, and other diseases are killing workers all over the world. U.S. researchers estimate over 95,000 deaths from long-term illness are much higher than previous estimates. By any count, tens of thousands of deaths each year in the U.S. due to long-term illness are way too many. Juka Takala, who's the president of the International Commission of Occupational Health and lead author of the 2014 study, says, cancers caused by work can be prevented by reducing or eliminating the exposures leading to the disease. So we know these fatalities, these injuries are preventable. To conclude, I'd like to say that we do know how to protect workers. We've been constructing buildings at heights, mining coal, and drilling oil manufacturing products for hundreds of years. We know tested, entirely effective protocols for making our workplaces safer. OSHA has clear and very well-known standards on fall protection, which is the single most violated safety standard in the U.S. We also know that there are many other violations which are not cited. If employers would follow procedures according to OSHA standards, we could protect workers. We also need to empower workers to save lives. National COSH encourages all workers to speak out if they see an unsafe condition at work. We also encourage that we stand up for our right to a safe workplace. We can reduce hazards and save many, many more lives.